Hi, and welcome to the Szott Automotive Health Insurance Overview. We have five plans to choose from, three HMOs, the HMO 5000, the HMO 500, the HMO 0, and two PPOs, the PPO 2500 and the PPO 250. I'd like to talk about the differences between an HMO and a PPO. With an HMO, you are required to pick a primary care doctor. He's going to be the guy that you go to for everything. And if he thinks you need to see a specialist, he's going to refer you to a specialist. So if your back hurts, you're going to go see your primary doctor, and he would refer you to a back specialist if he felt it was needed. With the PPO, you do not need referrals to go see specialists. If your back hurt, you could make an appointment with a back specialist. I will say that the specialists lately have been so busy that even without an HMO, or even if you have a PPO, some of them will not take you without a referral from your doctor. So keep that in mind. The biggest difference between the HMO and the PPO is that if you wanted to seek services out of the state, like if you had some rare condition and you wanted to go to Johns Hopkins University, with the HMO, you would not be allowed to do that. You'd have to stay with a facility inside the state. With the PPO, you could go to Johns Hopkins, but it would be out of network, so deductibles would double or more, and so would coinsurance. So it would cost you more to do that, but it is available. Now, if you have the HMO and you're on vacation, you can go to an after hours or an ER for health services. And all of these plans do have the online doctor service as well, which I will talk about later. So let's go to our first plan. Our first plan is the HMO 5000. So this plan has a $5,000 deductible for an individual and $10,000 for a two-person or family, and then 30% coinsurance after that. We're going to set all that aside for now, and let's go down to what happens if you have a normal office visit. So if you go to the doctor, it's going to cost you $40. If he wants to write a prescription for you, we're going to have one of the prescription drug copays listed below. Generics would run you $20 or less on this plan. Now, 98% of the prescriptions out there have a generic equivalent, so the majority of your prescriptions are going to be generics, and they would be $20 or less. If the doctor wanted to put you on something that doesn't have a generic, there are two brand names. There's the preferred brand name category and the non-preferred brand name category. Preferred brand names would be $70. Non-preferred would be $100. Tier 4 and 5 are the preferred specialty drugs and the non-preferred specialty drugs. These are extremely rare. The odds on you ever coming across one of these are very unlikely, but these are new drugs, experimental drugs, very rare. In this scenario, you would pay 20% for a preferred up to a maximum of $200. With the tier 5, you would pay 20% up to a maximum of $300. Now, I know $200 and $300 seems like a lot. As I've said, you're probably never going to see these, but you should understand that these are prescription drugs that can cost $50,000, $60,000 a month. So at least there's a small break there, quite a bit of break there if it, God forbid, you should ever have to do that. But odds are you probably won't see those. So let's go back, talk about urgent care. If you have to go to an urgent care, they charge $60. Now, I would recommend using the online service, which I'll talk about later. There is a way to do a visit online. It would only cost you your normal office visit, and it saves you the time and hassle of having to go to an after-hours clinic. If you go to an ER, there's a $250 copay. Now, if after being at the ER, they admit you to the hospital, that would be waived, but more than likely, when you go to the ER, there's a $250 deductible. That's why, once again, utilize urgent care or the online service whenever you can. So let's go back up and talk about deductible. So when does deductible kick in? Deductible is going to kick in anytime for anything outside of a normal office visit. So if you go to the doctor and the doctor says, you got a bad cough, I'd like to run an x-ray to see if you have bronchitis, you're going to be responsible for paying that x-ray, as well as other things like if you have a surgery, if you need stitches, casts, braces, things like that. You're going to be responsible for the first $5,000 of those products per year. for those services per year. Uh, if you reach the 5,000, the deductible is gone. Now, it says 10,000 for two-person or family. I do want to stress, though, that if you have a family of five and one member of the family gets sick and has to have a surgery, for example, they only have to pay $5,000 deductible. If any combination of the five family members reach 10,000, the whole family has reached the deductible. But just because one person gets sick and you have a family plan doesn't mean you'd have to reach the full $10,000 deductible. After deductible, there's coinsurance, which I like to call cost sharing. So you're going to pay 30% for services, and Blue Cross or BCN is going to pay 70%. So, for example, let's say you've met your deductible, you had a surgery and you paid the full 5,000. After that, the doctor wants to run an X-ray. Let's say the X-ray is $200. You're going to pay $60, and Blue Cross would pay the remainder. There is no coinsurance max, so you would pay for those services, the 30% for those services, up to the out-of-pocket max, which is $68.50. Now, I want to talk about the difference between coinsurance max and out-of-pocket max. So, out-of-pocket max is going to take into consideration every single dime you spend, whether it be for an office visit deductible or copay, whether it be for prescription drug copays, any deductible you've paid, and any coinsurance. At any point in the year, if you've reached $6,850 for any family member or yourself, everything is free for the rest of the year, all of your prescriptions and everything. 13.7 for a family, but once again, if one family member reaches the 68.50, everything's free. Let's move to the next plan. This is the BCN HMO 500. This one has a $500 deductible, 1,000 for a family. The coinsurance is only 10%. So if you had a surgery and you paid $500 and then you needed an X-ray, you'd pay 10% for that X-ray. So if it was $200, you would pay 20%, or you would pay 10%, which would be $20. This one does have a coinsurance max. So if you had $1 million surgery, you would pay your $500 deductible, then you would pay 10% for another $500. So $1 million surgery would only cost you $1,000 on this plan. That's the most you would pay for throughout the year if you had X-rays, MRIs, surgeries, blood work, anything. The most you would pay for those services would be $1,000 a year once. Once you've reached 1,000, you're done. The out-of-pocket max, once again, is going to take into consideration office visit copay. So if you've reached the $1,000, the 500 deductible and the 500 coinsurance, from that point on, all you would pay is office visit copays and prescription drug copays. When we look at this plan, you can see the office visit copay is down to $20, urgent care goes down to $40, and your ER goes down to $200. The prescription drugs are a little bit less expensive. You can see Tier 1 has a generic prescription drug of $20 or less. Tier 2 is $40 or less, which is the preferred brand names. Tier 3, the non-preferred brand names, is $80 or less. And then you can see the 20% for specialty, preferred specialty, and 20% for non-preferred specialty, which is the same at the $200 and $300 maximum limit. So if you were to reach your deductible and coinsurance, then all you would pay is office visit copays. If somehow you reach a total of $6,600 out of pocket max, everything would be free for the rest of the year. Let's move to our next plan. This is the HMO zero deductible plan. Similar to the other plan, although there is no deductible. So if you had to go get an X-ray, you would pay 25%. You'd only pay coinsurance, so you'd pay 25% of that. So if the X-ray was $200, you'd pay $50. And they're going to keep track of anything you have, surgeries, X-rays, MRIs, all of that stuff. And at any point, if you've paid $1,000 in those 25% coinsurance, then the only thing you would pay after that would be office visit copays, prescription drug copays. So this plan, if you had $1 million surgery, it would be same as the BCN 500. You'd still pay $1,000, but if you only had to have an X-ray, you'd only pay 25% rather than having to pay that first $500. The out-of-pocket max is still at $6,600, but you can see office visit copays are less at $15. ER copays drop to $150. Urgent care drops to $30, and it becomes a much more simpler drug card. You can see that generics are $10 or less. Preferred brand names are $20 or less, and then all others would be $40 or less. So you do get a little better prescription drug. There's also some things in here that I don't have listed here, but if you go into the plan details on this page, you'll be able to see all the plan details. But one of the things that I want to point out is there is differences in some of the office visit copays. Like on the $500 plan, if you go see a specialist, I believe it's $40 copay, whereas here, specialist or physical therapy. If you go to physical therapy, it's $40 on the other plan. On this one, it's still the 15. So there is some savings there. All right, our next plan we're going to move to are the PPO plans. We do not have a lot of employees on these plans because they're very expensive monthly, and what you get in services is not as good as the PPOs. What you're really paying for here is convenience, the idea of not having to have a primary care doctor and not being able to, or not having to have referrals for going to see specialists. And then the biggest one, which I think is really the biggest difference, is the ability to go see specialists outside the state, like at Johns Hopkins. So this one has a $2,500 deductible for an individual, $5,000 for a family, with 20% coinsurance after that. So 20% coinsurance is up to $2,500. So when we're talking about that $1 million surgery in this scenario, that $1 million surgery would cost you $5,000. There's an out-of-pocket max of $6,350. You can see office visits for $30. ER copays are $150, $60 for urgent care, and we have the simple three-tier drug card of $10 for generics, $40 for brand names, preferred brand names, and $80 for the non-preferred brand names and everything else. The last plan is the HMO or the PPO 250. You can see it has a $250 deductible for an individual, $500 for a family, and 20% coinsurance for another $2,500. So $1 million surgery here would cost you $2,750. Out-of-pocket max is $6,350. Office visit copays are $20. ER copays are $150, $20 for urgent care, and then a prescription drug card of $15 for generics, $30 for preferred brand names, and $60 for non-preferred brand names. I had talked about the online visits. If you go to your app store on your smartphone, or you can go right to the computer, you'll see that there are some, you can go to Blue Cross online visits. If you go to your app store and you type in Blue Cross of Michigan online visits, you can download the app. The way it works is you're going to put in your information, you're going to go on the phone, it's going to list all the doctors that are available to be seen that day. All those doctors are licensed in the state of Michigan, and you're going to pick one. It's going to tell you if there's people waiting in front of you. Maybe there's one that you'd start using and you like, so you might want to wait for him. You're going to pick that, wait for him to come online. He's going to then have a video conference call with you, determine what might be wrong, and he can call on prescriptions right to your drugstore. Not something you can use for everything. Obviously, if you think you've got a break, they can't do x-rays and things like that. But for coughs, colds, if you've strained your back, I've had people tell me that they call and they strain their back and they call on some muscle relaxers. My daughter used it the other day. Her son had a little rash on his arms. It was late in the evening before she was going on vacation, so she got on with the doctor. They looked at the rash and they determined what it was and what to do. So there's a lot of good reasons to use the online visit. And I tell you, I would really, really do that. All right, that is the basic overview of all the plans. As I said, there's more detailed plan information under the Plan Detail tab. You'll see at the top of the page my phone number. You can call me any time of the day, 24/7. If you call that phone number and push extension 1, it is going to ring my cell phone, and we are available here for you 24/7. If you have questions about the plans before you sign up, if you have issues after you have the plan, if you're wondering why you got a bill, if you're wondering what something's going to cost, you can reach out to us rather than reaching out to Blue Cross, and we're happy to help and answer those questions for you. Thank you for your time, and as I've said, please reach out to us for any help you need. Thank you.